Aloha, welcome to the Sports Medicine Clinic. My name is Dr. Joshua Peiper, and today I'm going to demonstrate a muscle energy technique for the hip flexor complex, which includes the psoas, the iliacus, and the rectus femoris. This technique uses a concept that Nadia Aguilar at Functional Patterns refers to as ground tension, where you pull the forward leg back while simultaneously pulling the backward leg forward like you're trying to squeeze the ground or floor in between your feet. To demonstrate the concept of ground tension, I'm going to use the valve slide so that you can see which isometric contractions I'm using to try to inhibit or shut off the hip flexor complex. So it is important to note that the valve slides are only for demonstration purposes. From a split stance or standing lunge position, I'm going to pull the forward leg back while simultaneously pulling the backward leg forward. So one more time, pulling the forward leg back and the backward leg forward. From the kneeling lunge position, I'm going to use the front leg to pull the back leg forward. And one more time. There are two variations of this exercise. The first variation that I'm going to demonstrate is the standing version. So I'm going to get into a standing lunge where I drag the leg with the affected hip flexor complex behind the lumbar spine. So we're trying to treat the right hip flexor complex in this example. So I'm going to get into the lunge where I move my hips down and forward while moving my shoulders behind my lumbar spine until I get to the first barrier where I can feel a light stretch along the hip flexor complex. So I'm going to maintain this position for about 10 seconds, and then I'm going to try to drag the rear leg forward, creating that ground tension for 5 seconds. After 5 seconds, I'm going to relax for 1 second and then lean deeper into the lunge where I'm taking my hips down and forward until I get to the next barrier. Once I get to the next barrier, I'm going to hold this new position for 10 seconds and then try to drag the rear leg forward for 5 seconds, relax, and then lean deeper into that lunge until I can get to the next barrier. The second variation of this exercise is performed from a kneeling lunge position. So I'm going to get into the kneeling lunge, and then I'm going to drag my hips forward and down, again dragging the leg with the affected hip flexor complex behind the lumbar spine, while at the same time leaning backwards so that my shoulders are behind the lumbar spine as well. So I'm going to move my hips down and forward till I get to the first barrier where I can feel that light stretch along the psoas. I'm going to hold this barrier for about 10 seconds. And after 10 seconds has elapsed, I'm going to try to drag the rear leg forward for 5 seconds. Relax for 1 second, and then sit deeper into that lunge until I get to the next barrier. Hold this barrier for about 10 seconds. Again, drag the rear leg forward for 5. Pause for a second, and then sit deeper into the lunge until I get to the next barrier. You want to perform each of these for 4 to 5 repetitions.